Now, we know schizophrenia is an entity that is, of course, heterogeneous, but also best considered as one entity at the more extreme end of the spectrum of psychotic disorders. Now, diagnosing schizophrenia requires an understanding of the stages of schizophrenia or stages of psychosis, and also having a structured approach to the diagnostic process. Because most individuals with schizophrenia in the initial stages present with a prodromal symptoms of psychosis that can easily be missed. These symptoms can span a number of non-psychotic elements. For example, they can present with mood disorders, they can present with obsessive compulsive disorder type symptoms, sleep disorders, etc. The prodromal symptoms, therefore, themselves are heterogeneous. The occurrence of, say, brief, limited, intermittent psychotic symptoms known as blips that occur just for a few days are an indicator of high risk of psychosis symptomatology, which in some individuals, if untreated, may transition to a psychotic disorder. When frank psychotic symptoms occur, initially they may be episodic, but then they could persist and become a more chronic schizophrenia type presentation. Thus, the diagnosis and management of early psychosis can pose some significant challenges for clinicians. And these symptoms are very fluid. Hence, let's look at a staging approach which allows us to have a higher index of suspicion for certain individuals. Many of these individuals may not transition to a psychotic disorder, but what it allows us to do is to intervene early should this happen, create a framework around them so that they can be monitored, and should there be any greater worsening or actual surfacing of symptoms of schizophreniform type illness, then we can actually treat the disorder.